Hi, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about elastics with braces or rubber bands with braces. Specifically, we're going to be talking about Class 2 and Class 3 elastics. These are two of the most popular configurations, but there's all kinds of elastics. There's triangles, there's box elastics, there's anterior elastics, there's cross elastics, there's Z elastics, and I have videos actually on all this already. You can just go into my section and look under the little search bar and then put that in and it'll come up. But I just wanted to go over a little bit more Class 2 and Class 3 because that's the most popular. Now for me, I don't start elastics on a patient until we've already finished the main steps, would be leveling and aligning, and I've worked my way up to rectangular wires. So if you are an orthodontist or a dentist, you know what this means. You have to finish your leveling and aligning. I work my way through my round arch wires in nighttime, my 14, my 16, my 18, and I get myself into a nice heavy wire like 18, 25, and that means and everything's straight at that point. I'm happy about how straight everything is. I'm happy about the bracket positioning. All I need to do next is maybe close some spaces, if I have any, and or fix the bite. That's all that's left. So you shouldn't be working on Class 2 and Class 3 until you got to that point, okay? So it might take 6 months, it might take a year, it might take 3 months, it might take a year and a half till you're ready. So that comes more towards the end for me. But let me show you how that works. So one great hack that you can use for elastics, if you don't have nails or if you're really not very dexterous, is to get an elastic placer. And most orthodontists will have this. And there's like a curved end, and then there's a little end that has a little pitchfork, and whatever end works for you. So let me show that to you. So here's how it works. And remember, elastics come in all different sizes and strengths. So they usually come in a certain amount of ounces. So 2 ounces usually light, 4 ounces usually medium, 6 to 6.5 ounce is heavy. And those are intraoral elastics. Then they also come in diameters, okay? So this, for example, I think this is 1/4, but it's the diameter of the circle, right? So they come as small as 1/8, 3/16, 1/4, 5/16, and so on. So for Class 2 or Class 3 elastics, obviously, you want to have the smallest diameter that your patient can comfortably take on and off by themselves. And I never let a patient leave my office until they can show me that they can take their elastics on and take them off properly by themselves without my help. Because it's real easy for us to put them on, but it's harder for them to put it on. And remember, Class 2 and Class 3 elastics only work when you wear them 22 hours a day. If you wear them 16 hours a day, you're probably going to get 0 results. It doesn't work that way. Your body has to get used to it. The bone has to get used to it. And intermittently wearing it is going to achieve nothing except for just discomfort and frustration. So if you aren't going to commit to wearing it full time, no sense in wearing them at all. You should let your doctor know, and your doctor can perhaps modify your treatment plan accordingly, and or maybe your doctor just can't fix your bite. So obviously, we want to try to give you a perfect outcome, so you need to try to follow the directions. I know it's frustrating. I had Class 2 elastics many times. So, but you know what? The more you wear them, they actually won't cause any discomfort or soreness once you start wearing them continuously and kind of get over that initial hump of getting used to wearing them. So let me show you what Class 2 elastics look like on a braces patient. Keep in mind that you may not look like this, but this is just a type of knot, right? So Class 2 elastics are meant to help to fix overjet, or when the front teeth are more forward of the lower teeth, okay? So ideal bite would be where your front teeth are pretty much almost touching your bottom teeth. So if it's like this, you have overjet and we need to fix it. So, this one has wax on it. So of course this is a little more tricky. Oh no, and I broke a bracket. Okay, so I'll just show you on this side. So Class 2 elastics normally go from the upper canine, assuming you have it, to the lower molar. Like this. Can you see that? Upper canine to lower molar. Now, as you can see, my fake patient here actually is missing some teeth. So I might actually go with a smaller diameter than this. This is, normally I use 3/16 heavy if I'm doing it on the proper wires. This I think is 1/4 medium, so this isn't really the right thing. But, you know, like I said, the smallest diameter that the patient can comfortably get on and off. So most of the time, 3/16 heavy is gonna be my go-to Class 2 or Class 3 elastic. But sometimes if a patient has a really big mouth and really big teeth, I'm gonna use 1/4 heavy. Sometimes they have a super tiny mouth, maybe they had some extractions, I'm gonna use 1/8 heavy. That's 6 ounce or 6.5 ounce. So you need to possibly stock quite a few different diameters and sizes of elastics in your office, because there's no like cookie cutter approach to this. Okay, so you've seen what Class 2 looks like. Again, upper canine to lower molar is Class 2. Now let's switch it around. Let's talk about those underbite patients or negative overjet patients and what class 3 elastics look like. So class 3 elastics are going to be the opposite. They're going to go from lower canine to upper molar. Let me show you. There you go. Class 3, okay? Lower canine to upper molar. Now, usually patients like this configuration better because you can't really see it. It's a lot more discreet and it doesn't look like spit coming out of your mouth. But, we can't pick which way our teeth are, so this is meant to be for more edge-to-edge bites or underbites. So that's class 3. And remember, if your patients, if you lose your elastics, you need to give your doctor a call because you need to continuously wear them. Or if you run out, give them a call. I've always been cool about throwing elastics in the mail and mailing them out to my patients so they don't have to come in and get more. Sometimes you're going to have asymmetric elastics, or you're going to have one elastic on one side and a different elastic on the other side. So here is class 3 on both sides, as you can see, okay? Sometimes you're going to have elastics in the front. Sometimes you're going to have triangles on the side. You might have boxes on the side. You might have zigzag elastics at the end. So many different configurations. Check in with your doctor regularly. How often does it take to correct a bite with class 2 or class 3 elastics? Well, it depends on if you're actually wearing them. So assuming if they're sized correctly and you have the right diameter, I've always noticed that patients can usually achieve 1 millimeter correction per month of continuous wear. That means if you have a 5 millimeter overjet, it should take 5 months of continuous wear. If you stop wearing them for a few days, you're gonna slip, and then it's gonna need a whole another month to catch up again. So you need to wear them continuously. And if you feel like you're overcorrecting, that happens sometimes. So always check with your doctor if you feel like you're overcorrecting. So for example, in a class 2 case, I tell patients that once their front teeth start to touch, that they need to give me a call because, without the elastics in, because we might need to discontinue the elastics earlier or pause them or just wear them at nights. And so good to know. All right. Thanks so much. Hopefully that was helpful. Take care.